Greetings. Welcome to Be My Guest. I am your host, Hamsha Naidu. Joining me today is Senator Jamie Eldridge. Welcome.
Thank you, Hamsha. Thank you for having me on your show.
Senator Eldridge has been the State Senator of Middlesex and Worcester District for 11 years. He is a long-time resident of Acton. Our topic today is very interesting and could be controversial sometimes. Complementary healing, alternate healing, or integrative medicine.
Yes.
So we'll use the word complementary for today.
Sounds good.
Yes, so it's a topic that I cherish dearly. And I should confess I am a grandmaster, Reiki grandmaster.
Yeah, that's terrific.
So happy to talk about Reiki, but I love all of them. We'll talk about everything. So Senator Eldridge, I would love to hear your views on these complementary therapies.
Absolutely. Yeah, I think what I've seen in the legislature really over the past 5 or 6 years is there's a greater recognition that alternative or complementary medicine and techniques are more and more accepted by the general public, by elected officials, and I think more and more even by health insurance companies. I've certainly seen, for example, with respect to the opioid crisis, instead of treating pain with painkillers, everything from acupuncture to yoga to different techniques to reduce people's stress or pain, and obviously doesn't have the fate of addiction. Side
effects of what the opioids will do.
Exactly. Exactly.
And it is very interesting that it's just not, it's mainstream that's becoming more and more involved and more into this.
Yes, absolutely.
So yes, so how do you think the Massachusetts healthcare system better support these complementary systems?
Well, the sort of, in its simplest form, there's been a lot more bills filed to require health insurance companies to cover these treatments. So, for example, there's been a bill in the legislature for many years for acupuncture. So, right now, most health insurance companies are not covering, acupuncture. So this would require acupuncture to be covered. And there are, other bills that are dealing with homeopathy to require health insurance companies to cover that. I think, you're seeing more doctors saying that, things like Reiki, do work. That acupuncture is something that makes a difference in people's lives. But unfortunately, health insurance companies, in my opinion, are resistant because they wouldn't make as much profit with these alternatives because they tend to be, of course, much less expensive.
Right. And the other thing is, especially with things like acupressure, they all sort of energy treatment, but acupuncture uses a little bit of those needles.
Yes.
So, but all of them are literally some kind of energy treatment. And so is Reiki.
Yes. And there's probably still a fair amount of skepticism about what does that mean, energy treatments.
Energy treatments, yes.
I'd be the first, as much as I now very much support Reiki, I would admit I probably don't 100% understand it.
Yes, I think you need to experience it a little bit.
Yes.
To get a better understanding and the way it's actually the energy fields in our body.
Okay.
And how it affects everything. Each thing has a good effect on the other.
Okay,
so
everything's connected.
Everything is connected,
okay.
Yes. And acupuncture does the same thing, acupressure does the same thing. It's like the list goes on. And like we said, every one of them complements the other. And I can use an example at my home. My husband has terrible back issues. And between the Reiki and the acupuncture, he really finds a lot of relief.
That's terrific. That's great.
And, so we have it right at our home.
Right. Versus more modern medicine.
Yes. Yeah. Well, you have to go through modern medicine. Some things you have to for quick relief because all of this takes a little longer to heal.
Okay.
So that's why I say emphasizing the word complementary.
Yes.
So they asked him to do surgery. He opted out of it, and I'm glad he did because they say it's not 100% positive. Not every time there's surgery comes out working out well. So in his case, he's gone the alternative route. He did have some injections that they do, but since then, he's gone for other treatments, including physiotherapy. And he's got a lot more relief.
That's wonderful.
He's not onto any opioids or any one of those.
Right, exactly.
So these are the things that's helping him move forward.
Yeah.
So
and that's so important because, of course, the legislature has taken a lot of action to combat the opioid crisis. But if people are still in pain, giving them those alternatives is absolutely so important.
Yes, and if insurance doesn't take care of it, it becomes very, very taxing on an individual.
Absolutely, absolutely.
So, it'll be, we'll really, really appreciate it if these things can go through our system, where the companies do pay attention to it and accept it for what it is.
No, I agree, and I will say that I'm the lead sponsor of an act to establish Medicare for all, creating a single-payer system, which, in my view, long term, would cover more of these complementary treatments, because there wouldn't be such of a focus on profit making by health insurance companies, in some cases hospitals.
So there's so many different ones, and I'm sure you're aware of that.
Yes.
I meant to bring my list, but I thought it's going to be way too much to bring a list out here to let you, and I'm sure you're quite aware of it. So it'll be really nice. It's the senior citizens also that has these issues, right? And where are they getting the money from? Or these?
Yeah, and with their Social Security generally not increasing, not having significant cost of living increases, it's really hard for a lot of seniors to pay their bills. And the fastest growing population in Massachusetts are seniors due to the baby boomers.
Right, and as I told you before this, I volunteer at the local hospital.
Yes.
And it's amazing that little time that we spend with them, what a difference it makes.
Yeah, just 10 minutes, it can make a big difference?
Yes. Typical Reiki treatment is between 60 minutes and 90 minutes.
Okay.
Whatever time we spend with them, it's amazing. And I am of opinion that in order for one to really be healthy, one needs a connection of body, mind, and spirit. And one of the things we do also is we communicate with these patients. We talk to them. And that also makes such a big difference in one's life.
The social interaction?
The social interaction, especially, everybody. Today, yes, we have social media.
Yeah.
And everybody's crazy over everything else, but the one-on-one conversation is not happening.
Yes, and I will say when I go to see my specialist at Mass General Hospital, most recently, they just implemented an electronic medical record system.
Yes.
So when I go in, the doctor's not even looking at me. He or she is just, on their laptop typing in data, and it's incredibly sort of antisocial, if you will.
It feels that way, doesn't it? And I am a health coach. A certified health coach as well. So one of the things we do, we sit with patients and have a nice conversation about the day-to-day activities, and it's amazing what a difference that makes to the patient. And that's another thing that the healthcare doesn't, the insurance doesn't cover. So I think health coaches also plays a very, very big role.
That's interesting. Okay.
Yes. You've not come across health coaches or didn't hear about?
I've certainly heard of health coaches, but I've never had a direct interaction in terms of what health coaches do, per se.
Okay. Yes, we do a series of, we see patients or our clients over a 3-month period or a 6-month period, meeting at least once in 2 weeks. And we have an hour's consultation and in finding out how the patient is doing, and quite often it's the patient that gets the answers from just having a one-to-one conversation.
Really realizing themselves. Okay.
Realizing it themselves. Of course, we are leading them to that end result.
Sure, yes.
Yes. And yes, insurance doesn't take care of that at all.
Right, yep. Yeah, so I think we need to move away from a health insurance model. Absolutely.
Yes, we have to cover all fields, everything that's making a human being feeling healthy and well.
Sure.
That's what is in my mind.
Absolutely.
Yes, and like I told you, Reiki is offered in most major hospitals in Boston.
Yeah, I had no idea.
Including Mass General, Dana-Farber, and Beth Israel Deaconess. They're endorsed by doctors and nurses for its calming and healthful effects. These are volunteer programs at this time. And you said you support them, right?
Absolutely, I do, and it sounds like, given that they're so present, and I know you do Reiki volunteer work at Emerson Hospital.
Yes.
Should the next step be that hospitals are paying grandmasters or masters of Reiki to practice this on patients?
I think so. What do you think?
I would be very supportive of that. I really think it's, looking at how do we improve healthcare outcomes for patients, for residents. And the reality is, in the United States, even though we're a developed country, healthcare outcomes, infant mortality, heart disease, diabetes, are among the worst in the world. So we're spending a lot on healthcare, but we're not getting very good outcomes.
I'm going to go a little bit off topic, and I am very much into healthy eating also, having.
Okay.
And I am of the opinion that if you feed yourself well, as well as having a good mind and everything else, you're going to be well.
Yep.
So maybe that's another thing that we need to emphasize on too, not necessarily telling them, you shouldn't be telling people anything, but encouraging them.
Absolutely. As well as the access to food. I mean, I know there's an issue with, Americans have access to too many processed foods.
Yes,
so
over-processed foods.
In some reasons, especially for those who are less well off, because that food is less expensive than fresh fruits or vegetables. So how do we provide more nutritious food to people that are maybe less well off?
Right, and the thing is, you can buy a 99-cent loaf of what they call a giant bread, but I don't know what the price is now. When we came here, we couldn't believe that, wow, we can buy a huge loaf of bread for 99 cents. But really speaking, that 99 cents bread, probably people can eat 4 to 6 slices of it and you're still not exactly satisfied. Whereas you buy the really good bread, which is maybe $3.99 or $4.99 a loaf, you just need 1 slice of the bread. It's like little things like that.
Sure.
But it's nothing to do with you. It's to do with our maybe.
Right.
It's to do with the way things have been done here previously to bring cheaper food.
Yes,
to the masses.
There's so many federal government subsidies for corn syrup, for unhealthy products, and that's why processed foods in some ways are less expensive.
Right, and it's cheaper to get corn than to get some other grain to make stuff, and but also people want to make this stuff last longer.
Yes.
So as a result, they add things that makes the thing less.
Right,
healthy.
preservatives. Yep.
Preservatives and things like that.
Yep.
So it's quite interesting.
It is. It is.
And like I said, it's a very, very vast topic.
Yes.
And we just skimmed over it, and I'm so glad that you are representing us at the White House. At our state.
The State House, exactly.
State House,
yep, so in Boston. Thank you very much. Yeah.
And it's very encouraging for me to know that you're looking out for us.
Thank you so much.
We are the day-to-day people on the street that really encourage this to everybody.
Thank you so much, and I see you at events all the time. You're very active as well, and that's part of my job, is meeting people and hearing about their experiences, and that's how we met.
Yes, we did, and I'd love it if you talk more about Reiki and alternate and complementary medicines and therapies going forward.
I will,
know
absolutely, I'm sure.
There's a million and one things to talk about, but this is our health. This is our future generation, and going forward, it'll be good that everybody lives a healthy life.
Absolutely agreed.
And thank you for taking time from your very busy schedule, speaking to me this afternoon.
Oh, thanks for having me on your show. It's been a real pleasure.
Thank you. And I'm your host, Hamsha Naidu. Till we meet again, be my guest. Bye-bye.